Well, when we talk about radiation therapy and cryotherapy, there's two sort of arbitrary ways we can define radiation therapy. There is a technique where we implant radiation seeds, or what we call seeds or pellets. We call this brachytherapy. And there's some similarity regarding that with cryotherapy, and that's typically an outpatient procedure. It also takes an equivalent amount of time. It requires a urologist to be in the operating room with a radiation oncologist and a physicist to deliver these radiation pellets. The anesthetic requirement is the same. The blood loss risk is virtually nothing, again, equal to cryotherapy. The patients in the short term will have similar urinary voiding irritation, which is overall extremely well tolerated. With brachytherapy in the long term, there are some unique risks associated with it. These radiation pellets, in a small percentage of cases, can migrate. We've seen them in the heart, we've seen them in the lung, in a small percentage of cases, but it is a unique risk to brachytherapy or the radiation pellet insertion. And then also in the long term, the radiation pellets can cause irritation on a chronic basis to urinary symptoms. They can cause irritation to the lining of the bladder and to the lining of the rectum. And they can cause chronic rectal symptoms and chronic urinary voiding symptoms. There is also some concern over the very long term that they can have an impact on increasing a risk of malignancy to the rectal wall and even possibly parts of the bladder wall. You don't see a risk of increased malignancy with cryoablation. There's never been any data to suggest that pure lowering of the temperature, freezing tissue, causes an increased risk of cancer, where we know that radiation techniques can do this. Now, with external beam radiation therapy, this is done differently from the radiation pellets. This is typically performed on an outpatient basis as well. Doesn't require any anesthesia, but it's 5 days a week for a period of 8 to 9 weeks. So there's a much bigger time commitment for the patients. Some patients find that a challenge depending upon their work commitments, their family commitments. There's no anesthetic required, but again, it's a 2-month time commitment. There's some expense that may be involved in that as well, and that's an individual consideration of travel and time away from one's responsibilities. Similarly, in the short term, there's very low risk of voiding or bladder challenges. Nonetheless, over the long term, later out, sometimes over time, months later, sometimes even a year or two later, patients can develop challenges with their urinary symptoms. They can sometimes develop challenges or complications of their rectal function. And there's also a risk of long-term increased risk of bladder and rectal wall conversions of new cancers. So these, I think, are some of the more unique, albeit small, but real risks to these other therapies outside of cryoablation.